Hello and welcome to my presentation. This is the contents of my presentation. Radiation has been used more than 100 years from 1896, X-rays and radium were used to treat cancer, stop infections, relieve inflammations. From 2009, I aided in the therapy of cancer, inflammations, autoimmune disease, Alzheimer's, Parkinson's, and other diseases. This table shows inflammatory diseases that were treated by X-rays. And on the left side, there's the different types of diseases. And then you see the number of patients that were treated, 37,500 in this study of various treatments. And the success rate varied from 60% to 95%. Protection systems remediate all diseases. Powerful protection systems act against oxidative damage and against internal and external harmful effects and diseases. Sadly, protection systems get weaker with increasing age. Our organisms require redox cell signaling. They use reactive oxygen species, which are made in the mitochondria of cells and elsewhere. However, reactive oxygen species cause oxidative damage to the DNA at an enormous high rate. We postulate that oxidative damage is a cause for Alzheimer's. This graph shows the rate of DNA damage caused by reactive oxygen species and the protection systems that decrease the damage enormously. If we didn't have antioxidant production, there would be potentially 10 to the 9th events per cell per day. The antioxidants reduce this by a factor of 1,000 to 10 to the 6th alterations per cell per day. Then we have repair systems, very powerful, reduced by 4 orders of magnitude to 100 persistent alterations per cell per day. And then we have removal systems as part of our protection systems, brings down to 1 mutation per cell per day. A burst of radiation causes DNA damage. You get direct hits and also radiolysis of water, which produces reactive oxygen species. Fortunately, low radiation is beneficial. It stimulates the protection systems. A burst of low radiation causes adaptive protection systems to over-respond. So we get strong, long-lasting recovery. A low dose stimulates protection systems, but a high dose inhibits them. Here you see the over-recovery from a low-dose burst. You see the damage and the recovery which overcompensates, over-responds. And the doses induced by large, more lasting recovery with 4 treatments in succession. You get a larger recovery and it's longer lasting. What is a low dose? It ranges from natural background radiation up to the threshold for the onset of lasting harm. And the high dose is exposure above that threshold. This is a Norwegian transgenic mouse study. Gene was removed from one of the two DNA strands, and that caused a 50% reduction in repair of oxidative damage. But one X-ray restored damage repair and normal brain performance. So these mice, the learning and memory ability of irradiated mice were the same as normal mice. So this is evidence that radiation stimulates the protection systems. Now we'll talk about Alzheimer's. A friend asked me to treat his wife. She was in hospice with severe Alzheimer's disease. We tried X-ray to her brain. She received improvement. We repeated the treatments, and we saw better quality of life for a period of approximately 2 years over her severe case prior to that, almost a vegetable. This is the improvement we observed after just one treatment. Her appetite was restored. Prior to that, she didn't want to eat. The caregiver was feeding her. Here she's eating by herself. And we saw improved responsiveness. I asked the patient to look at the camera, and she raised her head and looked at the cell phone, and we took a photo. This is a second patient. This is early stage Alzheimer. Started treatment in 2016 through 2017. The neurologist was adverse to treating with X-rays. Well, after one X-ray, mental clarity was better. His observations were returned. Reading aloud improved. The humor improved. He played the clarinet sheet music accurately after the treatment. Prior to that, it was full of errors. The patient asked for one X-ray every 2 weeks. The neurologist gave one X-ray every 4 months. So he wasn't getting the treatment that would have produced a good recovery. The doctor was afraid the medical profession would criticize. So the patient left after 2 years and tried hyperbaric oxygen therapy, which was totally useless, and he died in 2010 at the age of 77. I started an Alzheimer's disease study in Toronto in 2017. No one believed the evidence from Michigan. I urged Baycrest Health Sciences to treat 3 patients. Baycrest agreed to a joint pilot study with Sunnybrook, and the protocol was prepared. Application for human trials was prepared, and the consent form. We asked Health Canada for acceptance of using CT scans for therapy. The Research Ethics Board finally approved our study in July of 2018. The treatments in 2019, we treated 4 severe patients. Each received 3 CT scans, 1 every 2 weeks. There was subjective quantitative data collected, subjective data from the patient interaction with the relatives, and we recorded observations of behavior, the cognition. And we also carried out objective quantitative evidence at a postdoc, carried out 3 tests on each patient during and after the treatment. Good results were obtained. 3 patients, the subjective observation showed remarkable improvement in cognition and behavior. The objective measurements showed only minor improvements. 1 of the 4 patients, very severe case, showed no improvement whatsoever. So we've started now a larger, better study this year, 2022. We received funding from a large donor. The study is gold standard on 40 severe patients. The study is randomized, double-blind, placebo-controlled. If the evidence shows efficacy, we can expect more studies. Our objective is to find the optimum treatment and to better understand the effects of X-rays. Our goal is to prevent, replace, reverse, and stop Alzheimer's. Then we hopefully will start studies on other neurodegenerative diseases. So in conclusion, radiation has been used more than 120 years against cancer, infections, inflammations, and other diseases. Reactive oxygen species, which are produced for redox cell signaling, but they cause damage to DNA at an enormous rate. Oxidative damage is the likely cause of Alzheimer's. Our protection systems deal with all diseases and damage. So low doses of radiation stimulate the protection systems. Unfortunately, radiation health scare was started in 1956 to mislead the world that radiation causes mutations in cancer. So physicians now are reluctant and shun use of radiation for beneficial effects treating diseases. Fortunately, X-rays are a promising therapy for Alzheimer's disease. And this is a list of references pertaining to the studies that I've done. So thank you very much.